Doctors, your radiologists cannot read excessive motion. So your radiologists, I don't care how good the radiologists are, and I work with some of the top radiologists in the country, you cannot see excessive motion. You cannot see excessive motion. You can see if there's an anterolisthesis or a retrolisthesis. You can see that. You can't see what the amount is. But your radiologists in a 30-second read, 45-second max read, are not reading for the amount of excessive motion that there is. As a matter of fact, you will never get a radiology read where you're going to see level to level to level to level. C2, C3, what's the translation? Back and forth motion. C3, C4, C4, C5, C5, C6, C6, C7. Right down the line. Boom, boom, boom. Here it is. 2.3, 1.4, 2.6, 3.8. You're never going to see that for translation. You're never going to see what are the angular findings and what's the angular difference level to level. You're never going to see that in a 35 to 45 second x-ray read. That's not what it's designed to do. So in this market, this idea that the radiologist is somehow going to eyeball for excessive motion, nobody can eyeball. Nobody can eyeball for excessive motion. I've looked at hundreds of thousands of images, and I can't eyeball. I can get an estimate. I can look at that and say, yeah, I'm pretty sure that one's going to be a ratable level of ligament damage. I can look at them, and I can, some of the translation, yeah, anybody can see. You're going to see the translations. But you can't tell how much, and you can't really measure it accurately. So you want to have it done. Excessive motion test is a separate test. It's not your -22 professional component read. The radiologists that are doing an excessive motion study aren't even looking at all the images. So it's not a pathology study per se. You're not looking for infection, you're not looking for fracture, you're not looking for disease states. You're not looking to go, okay, where's the degeneration? What are the level of degeneration? How bad is it? That's not what you're looking for in an excessive motion study. In an excessive motion study, you're looking for excessive motion. Now, the reason why you're looking for excessive motion is because excessive motion is one of the most important imaging biomarkers in the injury space, in the spinal injury space. You have to remember that spinal injuries cause the first, fourth, and sixth leading cause of chronic pain and disability. Low back pain, neck pain, headaches are primarily caused by ligament damage to the cervical spine, right? So these injuries cause a lot of trouble, and they're the most expensive injuries in the market today. The doctors that can get good physical recovery results, whether it's in the acute injury stage or it's in the chronic pain stage, and you can get resolution fast. It may not be permanent. They may need supportive care, not huge levels of supportive care in order to maintain any correction that you've done. But those doctors that can get really, really good results basically should be the highest paid doctors in the market today because of how much they save the market, how much money they save the individual on future care costs. It's amazing what a good doctor can do. But the good doctor understands you cannot eyeball excessive motion. It's like an echocardiogram. Echocardiogram is a motion study of your heart. Now, you can tell how functional your heart is. How well is it pumping? What is the percentage of pumping that it's doing by an echocardiogram? But you can't just look in it. There's the heart beating. Good. I look at it. Oh, here, let me tell you what the effraction rate is. The effraction rate is a measured study. You freeze frame it in relaxation. You freeze frame it in total contraction. And basically, you are taking the difference and you're coming up with a rate, an effraction rate. So it's a study done with still images and measurements of those still images of a motion study. And that's essentially what excessive motion testing on a x-ray is. It, again, is the most important aspect of a spinal injury, bar none. If you have a disc herniation, the disc herniation is considered to be a pre-existing condition. You haven't identified it otherwise. If the patient's in an auto accident and basically you have a disc herniation, you haven't identified other than the fact that the person has a disc herniation. You haven't identified the fact it was caused by the car accident because there's no smart bomb of energy that just hits the disc. The best providers in the country know that. And so they know that you have to have the other tissue damage that would be sheared in that injury mechanism. So when the force is being delivered, it has to go through other tissue. It can't just hit the disc. And so the providers that know that are some of the most valuable providers in the market today, but they know that you cannot eyeball this stuff. And the other thing that they know is it needs to be done in an unbiased, independent manner. Look, excessive motion testing is one of the most important tests you're going to do. Here's what it does. It allows you to grade the sprain. It allows you to determine if you have surgical levels of excessive motion that are surgically qualified. It allows you to determine if you have surgical levels of excessive motion, you should have activity restrictions based on activity restriction guidelines. It allows you to determine the level of impairment that this injury now causes. It allows you to place your treatment into a category under guidelines that shows that your treatment is not excessive. It allows you to determine how bad and where the facet injuries are. It allows you to determine if the disc herniation is going to be there, and if it is there, that it was caused by the accident and not a pre-existing condition. It allows you to determine where the facet injuries are and how bad they are. It allows you to determine the upper cervical ligament injury, which mimics every single condition, almost every single condition of a mild traumatic brain injury, and is the most important injury in the whole traumatic brain injury space. When I say mild, there's really no mild, there's just traumatic brain injuries, right? So it allows you to correlate that perfectly, and it allows you to do all of it, but you have to understand the test, and you have to, there are offices today that they have paid employees that aren't doctors doing the test results, thinking that they're testing. That's not testing. That's I don't know what to call that. That'd be like if you had a $12 an hour person running an MRI machine, or worse yet, reading the MRIs. It's not validative of the testing procedure, and it really shouldn't be being done. So doctors, you need to have an excessive motion study, because you can't eyeball it. You can't eyeball these ligament injuries, and these ligament injuries are some of the most serious injuries in the market today. At Spinal Kinetics, our whole goal is to standardize the spinal injury workup. It's very simple. Patient comes in, you think they have damage to the ligaments. Good, you do an excessive motion test. You clinically correlate with what you find. You also may do an MRI for the disc ligament. You clinically correlate with the excessive motion study and the disc herniation. Remember, in the upper cervical spine, there is no disc, right? So you also are going to do the upper cervical spine ligament analysis with it. And that's what you're doing with it, and you want to have it done as much as possible by an unbiased, independent source, especially when their patient is in a medical legal situation, because the results are going to be more readily accepted if it's done by an unbiased. You're looked upon as biased, right? And God knows who's doing the study. They don't know if you're doing the study. They don't know if your front desk is doing the study, because in some offices, the front desk is doing the study. So you don't want to be part of that group. You don't want to be part of that crowd, and you don't want to be lumped into that crowd. That's why your professionalism in excessive motion testing is very, very important, because it protects you, it protects the patient, it protects everybody involved. So I highly recommend that you use an unbiased, independent source like us at Spinal Kinetics. If you need help with it, you just call us. We'll help you in any way that we can. You'll find that we're very helpful, and we appreciate your business.